Hi, I'm Richard. I'm a speech and language therapist and a lecturer based in the UK. In today's video, I'm going to provide a step-by-step guide how I critically appraised an opinion piece using the JBI Expert Opinion Checklist. I will be critically appraising Presence of Mind, which was written by Julia Caird and published in the Royal College of Speech and Language Therapists Bulletin magazine. In this piece, the author describes how yoga has benefited her work as a speech and language therapist. I hope this video will be useful to students learning how to critically appraise literature, practicing clinicians, and members of the public interested to know how healthcare professionals evaluate different kinds of evidence. Let's start with a brief definition of what critical appraisal is. Critical appraisal is a systematic evaluation of research to assess its usefulness and validity to a given context. A critical appraisal checklist is a tool used to help readers with this evaluation process. Each checklist contains a set of questions designed to prompt the reader to look for certain information in the research. The number and kind of questions in a checklist depend upon the kinds of study you are reading. The expert opinion checklist used today is published by JBI. This checklist asks 6 questions and asks the reader to rate each question yes, no, unclear, or not applicable. I will now go through each of these 6 questions in order and attempt to answer them. The JBI appraisal checklist asks whether the author is clearly identified, including their name, role, experience, and qualifications. The author's name and role are clearly visible at the end of the piece. Her name is Julia Caird and she is a highly specialist SLT. She does not list her current employer. In terms of her experience, she mentions working with children with language and behavioural needs in the 3rd column, but does not say how long she's been working as a speech and language therapist or with this group specifically. On her personal website, which is listed at the end of the piece, she says that she qualified as a speech and language therapist in 2013 and has worked with children aged from 18 months to 21 years for over 10 years. She says she currently works part-time in the NHS and part-time in private practice. There is no mention of her qualifications in the piece, but because she is a speech and language therapist in the UK, she has to have an undergraduate or master's degree in speech and language therapy and registered with the Health and Care Professions Council to practice, also known as the HCPC. I checked and she is currently on the HCPC register. On her personal website, she says she has also completed yoga teacher training and has a diploma in yoga therapy too. So for question 1 in the checklist, I would say yes, the source of the opinion is clearly identified. The checklist asks for health professionals or health researchers. What are their qualifications? What is their current role? Do they have indicators such as fellowships or are they licensed? And do they have any allegiances or affiliations with specific organisations or groups? This allows the reader to decide whether the author is informed or possesses knowledge about the specific subject they are writing about to assess the credibility of their opinion. We learned about the author's qualification and current role whilst answering the first question. In terms of fellowships or licenses, a fellowship is usually funding awarded to carry out training or research. There is no mention of any fellowship in the piece or on her personal website. Licensure means formally registering to carry out a trade or profession. We learned from the first question that she is registered with the HCPC and currently practices as a speech and language therapist in the UK. Yoga is a type of complementary and alternative medicine, also known as CAM. Unlike speech therapy, there is no statutory professional regulation, which means it is legal for anyone to practice yoga, even if they have no or limited formal qualifications or experience. Some complementary and alternative medicine practitioners have set up professional associations and voluntary registers to regulate themselves. One example is the Complementary and Natural Healthcare Council, also known as the CNHC, where yoga therapists can register themselves formally. The author does not appear to be a member of the CNHC. In terms of allegiances or affiliations with specific organisations or groups, she is a member of the Royal College of Speech and Language Therapists, also known as RCSLT, which is the professional body for speech and language therapists in the UK. So for question 2 on the checklist, I would say yes, the source of the opinion is standing in the field of expertise because she is a highly specialist SLT. It is more difficult to judge her standing in yoga because it is not a regulated profession like speech and language therapy, and she does not say whether she is voluntarily registered with bodies such as the CNHC. However, the author clearly lists where and when she gained her yoga qualifications and how long she has been practicing for, so I would still say yes to this question. The checklist asks, does the opinion take a position that advantages a profession or a specific institution, or body, or financial or political objectives, rather than benefiting patients and clients? In the first paragraph, the author asks, what does mindfulness, meditation, and yoga have to offer the speech and language therapy profession, and can they support the work of clinicians? Initially then, it looks like the focus of the opinion is on speech and language therapists. However, throughout the rest of the piece, the focus appears to be speech and language therapists adopting yoga practices to benefit their clients. In the first and second columns, she talks about clients benefiting from speech and language therapists modelling self-regulation skills to make patients feel calmer. In the third column, she talks about mindfulness and yoga being socially prescribed to benefit clients with anxiety. Towards the end of the piece, she talks about speech and language therapists using their self-observation to support parents to self-reflect. So for question 3 on the checklist, I would say yes, the interests of the relevant population are the central focus of the opinion. The checklist asks, does the opinion make sense? Does it demonstrate an attempt to justify the stance it takes? Is it the result of an analytical process drawing on experience or the literature? And does it comply with Toulmin's model for argumentation? I will now go through the piece paragraph by paragraph to answer some of these questions. In the first paragraph, the author opens the piece by asking what mindfulness, meditation and yoga can offer speech and language therapy and to benefit the work of clinicians. In the second paragraph, she lists several skills that someone needs to complete a degree in speech and language therapy and to practice successfully as a speech and language therapist, such as being calm, organised and having strategies for self-regulation. She goes on to suggest that it is important that speech and language therapists don't just talk about self-regulation, but model it live with their patients. She suggests that when we use soft skills such as being present, smiling, using active listening, acceptance and compassion, we create solid outcomes as our patients feel calmer. She claims this is backed up by research into mirror neurons. At this point, the opinion did not make sense. The first paragraph mentioned mindfulness, meditation and yoga, and there was no obvious clear connection between these practices and the skills listed in the second paragraph except perhaps being calm. The author went on to discuss self-regulation but did not provide any definition what she meant by this. Common examples of self-regulation skills might include the ability to recognize and label emotions, manage strong feelings and impulses, express emotions in socially appropriate ways, and being able to calm yourself down when upset. She went on to discuss several soft skills, but some of these were vague, such as being present and acceptance. As before, there was no clear, obvious connection between these soft skills and self-regulation skills or yoga more broadly. I agree with the idea that actively listening or smiling is likely to make someone feel calmer, but the almost throwaway comment that this is backed up by research into mirror neurons needed to be made more explicit and much clearer in terms of the underlying mechanism. In short, the author is suggesting that a client who observes the speech therapist smile has their mirror neuron system activated, which triggers them to release endorphins and make them feel calmer and happier as a result. This is not stated explicitly, which is why it is difficult to follow this argument unless you already know something about mirror neurons and how they work already. The reader must constantly infer to make sense of the argument. It is worth noting here that the evidence for the existence of mirror neurons in humans and their specific function in neurotypical people, never mind neurodiverse people who speech and language therapists work with, is disputed in the literature, so the author's claim is strong and does not necessarily reflect the complexity of the scientific literature. I have included a reference on the screen and in the description to an article written by Gregory Hickok, who was a professor in cognitive sciences at the University of California, Irvine, as an example of some of the arguments used against mirror neurons. But more importantly, it is not clear how any of this discussion of mirror neurons is relevant to yoga. In the third paragraph, The author claims that the body's ability to regulate itself arguably underpins our overall functioning, and that yoga and meditation are evidence-based ways to support our physiology to work efficiently and effectively. The first sentence states the obvious, but does not use appropriate scientific terminology such as homeostasis, which is the body's mostly automatic process for regulating itself to maintain a stable internal environment. This involves regulating physiological parameters such as blood glucose levels, blood pressure, and temperature, etc. I agree with the idea that yoga could potentially support with this, but the author needed to provide references rather than say yoga and meditation are evidence-based, and explain how specifically yoga and meditation help with which physiological processes, rather than just say work efficiently and effectively. For example, meditation could help reduce stress, which contributes towards high blood pressure. The rest of the third paragraph goes on to say that when bodies are well regulated, pro-social behaviours and communication abilities are supported. I agree with this, but felt she could have referred to clinical concepts such as arousal curves to strengthen this argument further. The author then claims that yoga allows people to work from a bottom-up, body-led approach, processing sensory experience, starting with the nervous system and heart rate. In contrast, she claims that speech and language therapists work from a top-down approach using language and cognition. In her own work, she found it essential to have a solid understanding of how the body and brain interact and to have tools to work with both. The first sentence again states the obvious, as all sensory experiences are processed by the nervous system. It is not made clear how yoga is any different to any other kind of behaviour which impacts sensation or heart rate. The author's distinction between bottom-up and top-down approaches is common in yoga, but is a false dichotomy as it suggests that there are only two possible options. Her description of yoga as bottom-up is problematic. She uses cognition to decide when to use yoga, and the bottom-up techniques she uses were presumably learned and memorized from a teacher who used language to communicate with her. Likewise, her suggestion that speech and language therapists work from a top-down approach is similarly simplistic. There are lots of different assessment and therapeutic approaches that do not use language and cognition, and could be considered bottom-up for her to use her terminology, such as intensive interaction or facial oral tract therapy, to give two very different examples used with completely different patient groups. Ultimately, both yoga and speech and language therapy involve a combination of both approaches if you believe that such approaches even exist as separate opposite categories. In the fourth paragraph, the author claims that no meaningful work can be done with children with language and behavioural needs until they feel safe and calm. She suggests that this view is common sense, but speech therapists often ask children with challenges with regulation to concentrate. She goes on to say that mindfulness and yoga are socially prescribed on the NHS for conditions such as anxiety, which people with a communication difficulty are at more risk of having. Finally, she suggests that speech therapists know that addressing a patient holistically is best practice and gives the best outcomes. I agree that it is difficult to work with people that do not feel safe and calm, but it is not clear that the solution to the problem of children having difficulty regulating themselves is speech and language therapists using yoga in their clinical practice. The reference to the social prescribing of mindfulness and yoga on the NHS for anxiety, with another claim about people with communication difficulties being more prone to anxiety, is not backed up by any evidence or references. The author does not state outright that speech therapists should use yoga, which means there was no clear, obvious connection between the points being made. The reader is left to imply that if they do not incorporate yoga into their practice, then they are arguably not delivering holistic care or getting the best outcomes for patients. In the fifth paragraph, the author explains that greater self-knowledge is at the centre of yogic philosophy. She suggests that through self-observation, speech therapists can become better clinicians by keeping themselves centred in difficult situations. They can assert boundaries when needed and give authentic feedback to patients. With these better skills, speech therapists are better equipped to support others to self-reflect too. She suggests that the reader knows that this is often the first step to change. She goes on to give a clinical example where parents will realise that despite doing their best, there isn't any time in the day when their child gets their undivided attention, and this is something that they would like to change. As before, there is no clear, obvious connection between the points being made. it is not clear how practicing yoga or self-observation, the speech and language therapist develops the skills listed, such as asserting boundaries when needed. Here we also notice some inconsistency in how the author describes yoga. In the previous columns, it was a bottom-up approach that focused on the body, but now seemingly it is a top-down approach using cognition and language. Even if we accept the author's argument, it is not made clear how the therapist's greater self-knowledge translates into supporting others to self-reflect. The clinical example given does not help clarify this either. How does the speech and language therapist support the parent to come to the realization that they do not give their child any of their undivided attention during the day? More fundamentally, it is not clear how yoga or self-observation is different from or adds anything to the more commonly used term reflection or reflective practice used within speech and language therapy. In the final paragraph, the author suggests that the reader can bring more presence to their clinical work by following some simple exercises such as counting your breath for 5 minutes or bringing all of your awareness to drinking a cup of tea. She suggests that this improved presence can then be shared with people the therapists work with and their patients to cultivate an environment of patience, self-awareness, creativity, and it also lowers the stress response in the body. As before, there is no clear, obvious connection between the points being made. The author does not explain how the exercises increase what she calls presence, which is not defined, or how it increased presence improves behaviours like creativity, not only in the therapist, but in other people. The reference to lowering the stress response in the body fell out of place in this paragraph and would have been better placed in the previous column as a potential mechanism to explain how a body-up approach works to help children regulate themselves. So for question 4 on the checklist, I would say no, the opinion does not demonstrate a logically defended argument to support the conclusions drawn. The checklist asks what literature does the author present to support the arguments. The author provided no references. In the second column, she mentions research into mirror neurons and that yoga and meditation are evidence-based ways to support our physiology to work efficiently and effectively, but provided no references to the research she was referring to. So for question 5 on the checklist, I would say no, there are no references to the existing literature. The checklist asks if the author has demonstrated awareness of alternate or dominant opinions in the literature, and have they provided an informed defence of their position as it relates to other opinions. We learn from questions 4 and 5 that the author did not provide any evidence to support their claims and provided no references to the literature. So for question 6 on the checklist, I would say no, any incongruence with the literature is not logically defended because she does not discuss any alternative viewpoints. Having read the article and listened to me critically appraise it, how do you feel about it now? Did you agree with my ratings, or would you have rated anything differently? Would you consider taking up yoga to improve your speech and language therapy practice? I'm now going to share my personal thoughts about the piece and offer suggestions about how I think it could be improved. I personally would not use this opinion piece to decide whether yoga can benefit my speech and language therapy practice. I don't feel it clearly describes what yoga is and what it could add to the toolbox of a speech and language therapist who already uses soft skills effectively and actively reflects upon their own clinical practice. Now, that's not to say that yoga itself has nothing to add, I just don't feel that this piece sold the practice particularly well. In terms of how the piece could be improved, I will give a few examples. First, I think there needed to be a much clearer definition of what yoga is in terms of a complex, multifaceted system of beliefs and practices. Second, the author could have explained how this definition maps onto current Western perceptions of yoga, which commonly associated with just the physical postures and breathing techniques, without necessarily acknowledging the wider philosophical and religious beliefs that are associated with yoga in Indian culture and Hinduism. In particular, it would have been useful to describe if there were any differences in how mindfulness is viewed and practiced, as it is a commonly used technique in lots of psychological therapies. The same can be said about the concept of self-knowledge and how it relates to reflective practice. Third, Given the limited length of the piece, I think it would have been better to focus on one aspect of yoga, such as the physical postures or breathing, and more thoroughly explain how one of these can improve speech and language therapy practice, with a much clearer rationale of the steps involved, and a well-described example or case study from one of the children she has worked with to illustrate this. The example given in the piece added very little. Fourth, the author could have provided references to the literature to back up the point she was making, or acknowledged that there is no or a limited evidence base to support yoga in speech and language therapy, and acknowledged that her views are based more on personal experience. After reading the piece, the reader is none the wiser about the current evidence base for yoga in speech and language therapy. Finally, there should have been an explicit financial disclaimer to explain that the author sells yoga therapy on her personal website, which is listed at the end of the piece, so the view presented is potentially not impartial. If you have found this video useful, give it a like and subscribe to receive notifications about similar videos in the future. If you have any comments, questions, or have a request for other research you would like me to critically appraise in the future, then let me know in the comments below or get in touch with me on Twitter. Otherwise, thanks for watching and take care.